There are a combination of privately owned and government-owned healthcare organizations and facilities. These facilities are either for-profit or non-profit organizations. A major issue our healthcare industry is facing is a growing workforce shortage. It is predicted that by 2025, we will have a shortage of 29,000 nurse practitioners and could lack as many as 400,000 home healthcare aides. As technological advancements in healthcare expand, so too will our need for more skilled workers with technology degrees. With the current pandemic, we have had to learn to lean on technology to not only manufacture new vaccinations, but to also find other ways to provide continued care for members in our community. 17 biotech companies in the Baltimore area have banded together to create a COVID-19 vaccination. With so many facilities having to close their doors and limit access to the public, telemedicine has granted many individuals the ability to continue to be seen by their providers, receive treatment, and monitor their health with the use of smart devices such as smartphones, computers, and iPads. The development of automation enabled by technologies such as robotics and artificial intelligence will bring the promise of higher productivity, increased efficiencies, safety, and convenience. The future of healthcare will be more patient-centric. This means that to remain highly competitive, the patient has to be the center of discussions and outcomes. New market entrants. When new competitors enter into an industry offering the same products or services, a company's competitive position will be at risk. An example would be Apple tests the market with wearables and electronic health records. As the health sector shifts toward customers, savvy new players are moving fast to capitalize on the change. In healthcare terms, vertical integration is the creation of about the strategic combinations of alliances in an effort to enhance the delivery of healthcare. An example would be Kaiser Permanente or Presbyterian Health System. The use of medical devices has transformed many aspects of clinical practice. This includes the rapid development of medical software applications. Some examples we see every day include continuous blood glucose monitors, blood pressure monitors, and insulin delivery devices, all of which are controlled by applications on our phones. Internet applications are also a growing technology. These assist healthcare professionals and has lent to the growth of telehealth, which has helped many, like those who are homebound. Though there are many benefits to the growth of mobile and internet medical applications, if left unchecked, there could be many lost jobs. Numerous internet applications and software are now available to assist HCPs with many important tasks, such as information and time management, health record maintenance and access, communications, and consulting. Healthcare organizations of all sizes are facing mounting pressures that require an increasingly strategic focus to balance cost, quality, and care and patient outcomes. Pressures to deliver improved outcomes with less resources are on the rise in the healthcare industry. The scale, complexity, and continuous changes across healthcare supply chains means a strategic approach is critical to ensure transformation resources are applied in the right areas to make the most impact. Within many healthcare systems worldwide, increased attention is being focused on human resource management. Specifically, human resources are one of three principal health system inputs, with the other two major inputs being physical capital and consumables. Strategic planning in healthcare organizations involves creating objectives and setting goals for where the organization sees itself in the long term. With these goals and objectives in mind, you can create a plan to achieve them. Sometimes you need to look at the hierarchy of your organization. Determining your company's goals and setting a path to achieve these goals motivates your staff at every level to succeed with you. The DSC initially constructed a framework consisting of elements of healthcare organizations focusing on outcomes of interest broadly defined as quality, cost, equity, and patient-centeredness. Next, it defined several common medical conditions grouped with domains based on commonalities with the resulting framework. Healthcare is a customer service industry. Companies and customers live or die based on the quality of care provided and the daily interactions between staff and patients. Great customer service starts with taking a patient-centric perspective, viewing them as people your company is meant to help. Today, health information management and technology professionals must have a deep understanding of not only the management of health data, but also the software and systems needed to manage and analyze data. Health information management technology is a discipline that encompasses two fields focused on improving patient outcomes and reducing healthcare costs. Healthcare revenue cycle management begins when a patient makes his or her appointment to seek medical services and ends when all claims and patient payments have been collected. Employees create a patient account that details medical histories and insurance coverage. EHR will make it easier for hospitals to bill for services. With rapid expansion of knowledge and technology and a health care system that performs far below acceptable levels for ensuring patient safety and needs, frontline health care professionals must understand the basics of quality improvement methodologies and terminology. Providers will make sure that the quality of care to their patients are up to the standard that will allow the quality of improvement, if there is any. Healthcare compliance professionals are needed to help clinical facilities and organizations address the ever-growing government regulations that set privacy and usage standards for patient information, ensure quality patient care, prevent fraud, and protect healthcare staff. HIPAA is one compliance that every doctor's office or hospital follow when it comes to making sure that policies and patient confidentiality is covered. Health marketing and communication is an emerging field that draws from traditional marketing theories and principles. It is defined as creating, communication, and delivering health information and interventions using customer-centered and science-based strategies to protect and promote the health of diverse populations. Marketing is the key to any organization. They need to make sure that their organization is out in the community. In order to compensate for the shortage of medical staff, the state recruited healthcare professors to help with clinical work, increased pay for nurses with more benefits they do not usually get, and on top of that, the state also passed a bill to force both state and private insurance cover telehealth, mainly during the COVID time. On top of that, the state could also focus on educating and providing more scholarships and tuition reimbursements for students majoring in healthcare.